The topic I have chosen to talk about is post-traumatic stress disorder. Post-traumatic stress disorder, or known as PTSD, is a type of anxiety disorder that can occur after you have gone through an extreme emotional trauma that has involved the threat of death or injury. The type of trauma that can cause PTSD are violence and abuse, disasters, war, and terrorism. The most common symptoms of having PTSD are having nightmares of the events or having flashbacks, sleepless nights, loss of interest, and the increased anxiety and emotional arousal. Some of the signs and risk factors of having PTSD are feeling upset by things that constantly remind you of what happened, having nightmares or flashbacks, like I said before, feeling emotionally cut back from others, feeling numb or losing interest in the things you used to love and care about, becoming depressed, fearing of always being in danger, living through dangerous events and trauma, getting hurt, seeing people hurt/killed, having little to no support after the trauma event, history of mental illness, dealing with extra stress such as losing your house, losing a job, or losing a loved one. Anyone and at any age can develop PTSD, but it's more common for these type of people to develop PTSD, and they are war veterans or the survivors of physical and sexual assault, abuse, accidents, or disasters, or anything that's like me. There are two different treatments for PTSD, which are counseling and medication. But let's start with counseling. There is psychotherapy, which is talk therapy, and there's cognitive behavioral therapy, which is CBT, and there's different parts to that. There's exposure therapy, cognitive restructuring, and there's stress inoculation treatment. And now on to the medication. There are two of them, and there are both antidepressants. And the first one is paroxetine, which is Paxil, and then there is Steriline, which they call Zoloft. I'm not sure if I'm saying that right, but I'm hopefully am. Well, thank you for watching my video, and hopefully if you think that you have PTSD, you'll go get help because there's always treatment.